Do you need blood work to diagnose perimenopause? I'm Dr. Jen, double-boarded OBGYN in whole body medicine, and I practice menopause care as well as longevity medicine. So it depends. So my dear friend, Dr. Shiva, she's awesome on Instagram, she often says, it depends, right? This is very personal. So if you're somebody who's, say, below the age of 40 and you're having hot flashes, night sweats, it seems like you're in menopause, not perimenopause, then yes, blood work can be very useful to make that diagnosis. Even below the age of 45, if we're talking about early menopause, because honestly, that affects your long-term health. And so it's important to know, are you already at that stage? If you're someone who's, say, 45 and you're experiencing changes in your cycle, you're having difficulty sleeping, maybe feeling warm, having night sweats, low libido, changes in the vaginal area with dryness, like by definition, you met the perimenopause diagnosis. It can lead up to 10 years before menopause, which is when you've had 1 year without periods. And so you don't have to get blood work to prove that. And in fact, blood work sometimes can be very confusing because your levels are going up and down, up and down, up and down, but ultimately going down, especially with estradiol, which is more of like a roller coaster. And so you can test someone 3 times in, say, 6 weeks, and their levels could look normal, could look high, could look low. And so you're literally watching this roller coaster of estradiol on its way down. So we don't make that as a barrier to getting treatment for perimenopause care, so you don't have to get checked. This is also why a lot of women say, my labs are normal. They say I'm not in perimenopause, which could not be further from the truth. And honestly, we should have a better definition so that women are not being dismissed and not being told that they're not in perimenopause because their labs are normal. Because the range of estradiol is really large. So we don't have a perimenopause value. We have postmenopause, premenopause. So lab work can be useful for you if you want to understand how to personalize, say, your hormone replacement therapy. I check blood work personally on every woman in perimenopause because I want to understand their baseline. I also want to, when I put them on hormone replacement therapy, I want to be able to monitor them, especially testosterone, because there's no cycle-specific sign that you need testosterone. So I check them, but it is not a requirement to be diagnosed with perimenopause to receive treatment. So hopefully this answer makes sense to you. If you have specific questions, throw them down in the comments. I'm happy to answer them. Happy to make a video specifically about it. But just because your labs are normal, that does not mean that you're not in perimenopause. Okay? All right.